Welcome to Field Notes, Insights from New to Public Health Alumni. New to Public Health is a year-long workforce training program for those who are new into the field of public health. I'm Juliana Mansky.
And I'm Mackenzie Legal. We are program facilitators and hosts of this podcast. With a vibrant community of over 400 current and past residents, New to Public Health is a wealth of knowledge and experience in the public health field.
In each episode, we'll share inspiring stories and valuable insights from those who've journeyed into public health, highlighting their unique path and the impact they're making. Joining us today is Monal Desai, a public health nurse. Monal graduated from the New to Public Health Residency Program in June 2025. Monal, thank you so much for joining us today. Would you start by telling us a little bit about yourself and how your community shaped who you are today?
Sure. Hi. Thank you, Juliana, so much for having me. It's truly an honor to be on this podcast. I've really enjoyed reflecting on some of the questions that you will be asking. So I'm excited to share my journey and story today. I was born in Zimbabwe, and I was raised in a Hindu family within a close-knit Indian community, while also being surrounded by African culture. So looking back, community was a big part in my childhood. In my childhood, I grew up playing a lot of sports, participating in many community gatherings, and spending a lot of time on the weekends with family and friends. So there was always a strong sense of belonging and people looking out for one another. Growing up also in Zimbabwe exposed me to different cultures and taught me to appreciate different perspectives from each of those cultures. It showed me that our culture, our values, beliefs, and our lived experiences shape who we are and how we see the world. When I moved from Zimbabwe to the US, I gained another perspective by seeing people bring their different cultures together into one community. So looking back, those experiences became my foundation for how I approached nursing and public health today.
Yes, our childhood experiences are so foundational to the work and who we bring to ourselves in our career. Speaking of your nursing career, what first drew you to nursing and what do you enjoy most about caring for your patients?
Sure. So from an early age, I've always been drawn to protecting other people and serving others. So I was fortunate to grow up in a strong community that uplifted and supported one another. And that inspired me to give back through nursing today. For me, nursing is about building trust and caring for others as individuals, not simply just treating the illness. I also enjoy the medical side of nursing and learning about diseases. Understanding about their disease process helps me connect the dots and see how illness affects every aspect of a person's life. Nursing has taught me empathy, patience, and the importance of meeting people where they are.
Such important feedback and such a vital public health perspective. How has that perspective shaped the way that you work as a public health nurse?
So, as a public health nurse, I approach every person with kindness and an open mind. And I often ask myself, how can I help them help themselves? Public health has expanded my perspective from caring for one person to caring for the entire community. One of the things I enjoy the most about public health is that it's really watching out for each other. And in this case, we focus on prevention because if we identify something that could affect the community, then we have the opportunity to work with each other before the bigger problems develop. And I believe in public health, education is very important because it empowers people. When you connect with each other and you connect the resources to other individuals and help them understand the factors that influence health, it allows them to make better decisions for their health. So building trust, showing empathy, and meeting where people are creates a meaningful and lasting change from my perspective.
Yes, that person-centered perspective is really powerful and really the heart of what we do as nurses and within the public health sphere. So let's maybe transition a little bit to talk about your time in the New to Public Health residency program. How did that program influence the nurse and leader that you're becoming and are today?
So one of the biggest things from the residency, it gave me perspective. It deepened my understanding of why public health matters. And it also helped me appreciate the many ways that public health quietly protects communities through prevention, education, and collaboration with other people or other healthcare professional, healthcare organizations. It also changed the way I think as a public health nurse. I've become much more intentional about recognizing barriers because barriers directly affect the health outcomes in our community. If we can identify those barriers earlier and work together to address them, we make it easier for the individuals in our communities to improve their health. So the residency also helped me realize that I have an important voice at the table. My life experiences, my nursing background, and my public health perspective, each bringing something valuable to the conversation. It has also given me the confidence to contribute ideas, collaborate with others, advocate for solutions, and help strengthen healthier communities.
I love that so much. I'm so glad that you were able to really apply a lot of the principles that we talk about in the program to your practice um, and be part of those conversations because each of our work is so important. And and I'm so glad that you had all of those takeaways from it that you can apply to your job and your community and all of your patients. So, as we kind of look forward in the future, what advice would you like to leave with others?
Sure. I'd encourage others to continue to stay curious and open-minded and be adaptable to change. Healthcare and public health is always constantly evolving, and every experience is an opportunity to learn and grow. I would also encourage people to believe in themselves and not be afraid to share their story because each experience can inspire somebody else to discover their own purpose or make a difference in somebody else's life. So, looking back, everything I've shared today comes back to one word, and that is community. I was fortunate to grow up in a community that uplifted, supported, and looked out for me and also for others. And that experience has inspired me to dedicate my career to helping build healthier communities. I often think of my life nursing and public health as a jigsaw puzzle. Every person, every family, culture, profession, community, and life experience represents a different piece to that puzzle. Growing up in Zimbabwe gave me one piece, nursing gave me another, and public health expanded the picture. And then the public health residency helped me understand how all of those fit together. One principle that has continued to guide me in my journey is one of Mahatma Gandhi's quotes: "Be the change you wish to see in the world." That quote has resonated throughout my life and has also motivated me to continue searching for my purpose. And it reminds me that meaningful change begins with each one of us. We all have a unique piece to the puzzle to contribute. When we bring those pieces together, we don't just improve health, we strengthen communities, inspire each other, and create a meaningful change.
Monal, that is one of my favorite quotes too, to be the change we wish to see in the world. What beautiful words that you have to share and live by. Thank you so much for joining us today. We really appreciate your time and thoughts and wish you the best in your public health nursing career as we move forward.
And thank you so much again for having me. It was a pleasure to explore this with the public health residency community and to share my story.
Thank you for listening to Field Notes, Insights from New to Public Health Alumni. For more information, visit new2publichealth.wisc.edu.